The reason that I chose cardiovascular surgery is because since I was a little kid, I have always been fascinated with the heart. And I remember being in grade school, second, third grade, and getting a book out of the library about heart surgery. And I remember looking at that book for hours. In fact, I rechecked it out over and over through the school year. And I've always been just fascinated with the human heart and how it works. I got my undergraduate degree in biomedical engineering at Mississippi State University. And because I grew up in Jackson, my family grew up in Mississippi, so I've always been a Mississippi guy. And after I got my engineering degree, I knew in college that I wanted to be a doctor, and I thought that biomedical engineering would be the most interesting sort of route to that. And so after that, I went to the University of Mississippi Medical Center and got my MD degree. And then I knew that I wanted to be a heart surgeon really from the get-go. So I was always looking for the best programs, the best training programs. And so the University of Alabama at Birmingham was always on my radar. And I was fortunate enough to get a spot there to do both my general surgery training and my cardiac surgery training. When you talk about cardiovascular surgery, my passion is cardiac valve surgery, operating on the valves of the heart, particularly repairing the mitral valve. Many people have valves that leak, mitral valves, and a much better way of addressing that problem than just replacing the valve is to repair it. But it's difficult because it requires both a knowledge of science and sort of technical skill with an artistic sort of bent. When you're operating on a patient, when you're doing surgery on people, it's a very personal relationship. I mean, it takes a lot of trust for somebody to sort of basically give up control to somebody that they may not even know very well. I don't start my job when I walk into the hospital each day and end my job when I walk out each night. I spend a lot of time at home, on the weekends, at night, what have you, thinking about my patients.